And now it's time for Family Health Matters with your host, Miss Wendy Bridgers, First Lady, RN. She is a registered nurse for over 35 years, and she has graduated from North Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born-again child of the Most High King.
Okay, so we're waiting for Wendy to come in. She is having a little bit of technical difficulty. I am Renee Spain, and I was with Wendy Bridgers last week talking a little bit about safety and COVID during pregnancy. So I am a certified nurse midwife. I practice at the Pitt County Health Department. I have been a midwife for almost 20 years and am currently teaching in the midwifery and FNP programs at East Carolina University. It looks like Wendy may be on mute, and so we are trying to get her up and running so that she can join us. So I'm just going to do a few highlights from last week and wing this until Wendy can join us. So last week we talked about how to keep yourself and your family safe during COVID. So we talked about using the special hours that many stores have put out for vulnerable populations, and pregnant women are considered that are our vulnerable population. So be sure you're taking advantage of those hours. Make sure that you are keeping your appointments with your prenatal provider, and that may be a telehealth appointment or it may be an in-person appointment. You need to make sure that you've got plenty of medicines. Remember the things that the CDC has talked about with us. Make sure that you are wearing your mask. Make sure you are washing your hands frequently. And you can either wash your hands with soap and water, or when you're out and you don't have access to soap and water, stick a bottle of hand sanitizer in your purse, your bag, your car, and use that. And wait 6 feet apart. So when you're choosing where you're going and what you're doing, make sure that you are able to take those into consideration and use those precautions. We talked a little bit about how some of our providers are using telehealth. And so some of your prenatal visits may be virtual visits, and some of your prenatal visits might be in-person visits. So there are some things that we can't do for you virtually. So sometimes you may need to come in and have a lab test done. So you would have to come in and be seen in the clinic. We do need to put our hands on you at times. We need to measure your belly. We need to listen to your baby. And we need to just take a look at you to make sure that there are not any problems going on that you have not perceived that we can tell by looking at you. We are still working on trying to get Wendy on, so we're going to talk a little bit about what other things that we can do. So we talked about baby showers and how we can be creative in how we do that, because we know everybody wants to come and celebrate the new mom and see the new baby. So when we're talking about baby showers, we talked about doing some creative things like a drive-by baby shower. So this is what we did for my daughter. She had a baby July 1st. And so we did a drive-by shower. So we set up a tent in the driveway of the church. We had goodies to go, and we had folks come in, drop off their gift, wave at mom from the car, do some new advice for mom on little cards that then she could put in her baby book to keep those memories. We had folks take pictures. So that's an idea. You can do Zoom baby showers. That's what we're doing for bridal showers now. In the College of Nursing, we have a couple of folks getting married, and so we are doing some Zoom meetings for bridal showers. So you can use all those platforms that are out there and be a little creative about what we're going to do. So hi, oh, you're here. So I was just kind of rambling on about what we talked about last week. Oh no, now I can't hear her again. Okay, so now we're going to move on to a little bit new topic. So we're going to talk about what to expect when you go to the hospital. So when we know that we're not having childbirth classes, but there's some nice resources out there that you can use. So ask your provider what those resources are. Some of your practices may have some resources on their websites for you to be able to access. March of Dimes has some nice information. Lamaze International has some nice information, but make sure you're going to a reputable place to get information about how to prepare for labor and how to prepare for birth. Also, while you're at your physician's office or your provider's office, please ask your providers questions that you might have about labor and delivery. So things like, what can I use for pain control? Who can come and be with me when I have my baby? What do I need to take? Currently, there are some restrictions at the hospital, as we all know, because of COVID-19. Right now, and again, you should check because week by week things change. So we need to check weekly with your provider, however often that you're going in, to see who can go with you. Right now we are we are allowing one support person to go with you. So you pick who that is, and you know, it doesn't matter as long as that's the person you want to be with you. So it might be your husband, your spouse, your partner, it might be your mom, it might be your sister, it might be an aunt or a friend, but whomever you choose to go with you to the hospital is going to be the one person that has to stay with you the whole time. So when you're packing your bag to go, make sure you pack your support person's bag as well. Be sure you take your car seat with you because you will need a car seat, and that's an infant car seat, and take it into the hospital with you. They're going to put the baby in the car seat, or you're going to put the baby in the car seat to be able to go out to the car. Make sure that you're taking clothes for the baby. Take some snacks if you have specific things that you want to snack on. Unfortunately, right now, we're not able to have people go in and out of the hospital. But what you can do is your family can come to the front door and your partner can walk to the front door and get things for you. So if you get there and you realize you forgot your toothbrush, or you forgot your hairbrush, or you forgot your favorite pair of shoes that you absolutely need to come home in, somebody can come to the front door, drop a bag off to your partner, and then he can take it back to your room.
Renee.
Yes. Hallelujah.
Well, I think I'm back for a while anyway.
Okay, very good.
I am so sorry. I don't know, technical difficulties.
That's okay. I rambled on, so.
It sounds like you got it going on. Thank you. Thank you. But let me ask you one question about the car seat.
Okay.
Now, I've heard that with the guidelines, not related to COVID, but just infant car seats. Now, isn't there somewhere you're supposed to get those checked now?
You can't at the fire department, and I'm not sure, you'd have to call the fire department, or you can call the health department and ask about infant seats inspections. I know that they had been doing them at the fire department on Fridays.
Okay.
At the big fire department downtown. I don't know with COVID if they are still doing that or not. But you could certainly call. Vidant also has an injury prevention program. And so if you call Vidant and ask about the injury prevention program, they may be able to tell you about getting your car seat checked.
Okay, good, good. Because I know that a lot, especially new moms and new dads, are not, really familiar with buckling them in and making sure that they're secured and tight. And so I wanted to make sure we mentioned that, because I do think that there are some places that they can be checked.
Yes.
To make sure that, you're putting them in right.
Right. And even some of us folks that have, we had children long, long ago.
Right.
These newfangled car seats, and they all go in differently, and that's what you need to make sure that so you need to know specifically how your car seat fits in the vehicle. For infants, they need to be rear facing car seats.
Right.
And that's the really big important thing to remember. Most of your car seats are going to be, for infants, are going to be those small carrier type car seats. And, I know we all like to have the fancy pink and blue and really pretty ones, but you really just need a basic car seat. That's all you really have to have. You don't have to have anything big and fancy. You need to make sure that it is an approved car seat, and it's got a seal on the box that says it's been tested. They have side impact testing, and they have rear impact testing. The reason we put the baby in the car seat rear facing is because if you have an impact and that baby is buckled in properly, that car seat is going to kind of envelop or come around that baby and protect the baby. And the baby's head remember, babies don't have much head control.
Right.
And so if, like with you sitting in the front, in the seat forward facing, if you make that sudden stop, your head snaps forward.
Mm-hmm.
If that baby is in that rear car seat, that whole seat is designed to come forward and hold that baby in place so that that head doesn't snap and we don't have that issue.
Yeah, and I think too, making sure we're not putting too many paddings inside of that car seat.
Yeah. Don't put anything
like
in the car seat.
Things are cute, and you want the baby to be cute, but the more padding you have inside of it doesn't necessarily mean that it's making it safer.
It makes it actually less safe. So the baby should be in there in just his clothes, not blankets, not coats. You can put the little straps on, the little covers that cover the straps that are flat. You can put the little thing that goes around the baby's head that's approved, that's flat on the bottom, that fits so that the straps fit through that. But look for things that are approved.
Yeah. Okay, good, good. Now I heard you talking about the support person that comes with you.
Right.
And unfortunately now it's probably like one person that can actually come into the hospital with you, but that is, your baby, your protection, as well as the staff and everybody that's around.
That's right, and that's why we do that. And I know that's not what everybody wants, and that may not be what you envisioned. It certainly was not what my daughter envisioned.
Right. Yeah.
But remember, we have technology and we can share things. Check with the hospital, make sure when you can use those FaceTime apps, and most everybody's got a smartphone. Some of us have smarter phones than others, and some of us are better at using them than others. But make sure that you download on your mama's or your grandma's phone whatever the app is that you want her to use. My kids all have iPhones. I don't have one. But but she downloaded whatever the little app was that I needed so that she could FaceTime me once the baby was born.
Right.
So there's ways that we can do that. There also, and my husband said, I think we're going to be in trouble here because their room had a window in it. So we went over to the hospital and she stood at the window with the baby and we looked in through the window. So some of the rooms do have windows, and you can look out the window and some of your family can potentially see you that way.
Yeah, and as creative as people are nowadays, I mean, you can make it work. You can make it work.
It's not ideal, but remember, it's 24 to 48 hours for most of us. If everything is well and good, and you have a spontaneous vaginal delivery and everything's good with the baby and everything's good with you, they will generally let you come home in 24 hours.
Yeah.
Some folks might have to stay for 48 or 72, but most folks can come home in 24 hours. And
Great.
so,
Yeah.
yeah, you can
And
share
I
when
think
you get
too, the
home.
only big difference, I mean, we care for our moms and babies as much as possible, safely. And I think you'll just see the mask, people wearing face masks or face,
Absolutely.
and that would
Now,
be,
they don't make the support person wear a mask in the room.
oh,
But
okay.
if the support person leaves the room, they do have to wear a mask. So
Okay.
when my son-in-law came out to the lobby to pick up dinner that we brought, he had his mask on
Hmm.
and he had to sanitize his hands when he walked back through the lobby.
Right.
And really and truly, with a new baby, everybody who touches that baby, whether we have a pandemic or not, ought to be washing their hands before they touch the baby.
Absolutely. Absolutely. And
And
that,
that's
go ahead. I'm sorry.
and it's okay to tell people you can't touch my baby unless you wash your hands. That's
Hmm.
an okay thing to say.
Right, right. And I think too, that leads us to, before we run out of time, that leads us to getting ready to go home.
Yeah.
Because
So,
I want you to,
uh-oh, you cut out again. It seems that we have lost Wendy again. So we're going to talk a little bit about what to do when you get home. And Akila's going to be the timekeeper for me so that we don't go over. And we're going to hope Wendy can join us back. So, in the hospital, we have very limited visitation right now. And we talked a little bit about making sure people wash their hands. When you get home with your baby, whether you have a pandemic or not, you really don't need to have everybody on God's green earth in to spread germs on your baby. Remember, babies have a weak immune system. It's just not developed yet. So just like we would limit our visitors when we're adults, we're going to do the same thing for the baby. That doesn't mean you need to isolate yourself and you can't have people in, but remember to use those precautions. If you're going to have people come in, you may want to ask them to wear a mask, and that's an okay thing. Make sure that anybody who is going to touch the baby washes their hands with soap and water. Make sure that they're not kissing on the baby and touching the baby's face and hands. Remember, babies take their hands and put them in their mouth, and it's really hard to wash little hands when they're like this. So just having people not touch their hands and not touch the baby's face is a really good idea. And limit those people. If these are not people that you are seeing regularly, then these are not people that you want trooping through your house right now just because you have a new baby. Again, using that technology that we have available. And then we can use FaceTime, we can use Zoom, and introduce your baby that way. We had a really hard time trying to figure out who was going to get to come see the baby and who was not going to come see the baby. We have a really large family. My husband is one of 4 children, and I have 2 sisters. We all live right here. My husband's family gets together. Before the pandemic, we all ate together at least once a week, and there's 30 to 40 of us by the time we get together with all the children, because he's the youngest and all the rest of them have children. And so trying to figure out who was going to get to come see this baby and who was not was a real challenge. And did we let the kids in and did we not let the kids in? And ultimately, we decided that for the first couple of weeks, it was just going to be the grandparents and Anna and Mitchell's siblings. And that's an okay thing to do. And then after that, she has slowly let people come in to see the baby, but still not letting lots of people in, not taking the baby to the grocery store when she goes to the grocery store or goes to Target. The other issue we've had to try to think about is, do we take the baby to church?
mm,
We go to a very small church, and we are meeting in person in our church, and we are socially distanced in church. But trying to figure out, do we take the baby to church? And we did have baby dedication Sunday, and that was at the request of we have I think we have 6 new babies. They were all born within the last couple of months. And
Oh,
so
wow.
we did do baby dedication Sunday, and we did take the baby, but she stayed in her car seat with a cover over her, except for when Anna and Mitchell had her up for all the stuff on stage with her. And the other moms did the same thing. So I think you can do some of those things. You just have to kind of put those barriers up and say, right now, we would prefer that people not get too close, and we're not gonna have people touch the baby. And talk to your pediatrician. And that's what we did. We talked to the pediatrician to see what her pediatrician recommended. And you know, we went on a family vacation where all of us go, like all 30 or 40 of us go to one location for a week. And Pete said, you know, if these are people that you are around frequently, just, you know, kind of sit and don't let everybody touch, and don't play pass around the baby.
Yeah.
And so that's what we did.
Well, Renee, really quickly, can you hear me?
I can.
Oh, okay.
Yay!
Tell us a little. We got 3 minutes to go. Tell us about mental health. You know, postpartum depression. Just really, really quickly.
We talked
a little. Real.
We talked about a little bit last week about making sure that you are, if you're having those feelings of anxiety or depression, that you reach out to your provider, because that is a real issue with a lot of the social isolation. The same thing postpartum. The important thing to remember is that we want you to be able to take care of yourself and your baby. And if you're at a point, you know, we have the baby blues and they last a couple of weeks. But after a couple of weeks, if you don't feel like you can take care of yourself and your baby, and you're having trouble getting up and getting your life together and taking care of yourself and taking a shower and getting those things done that you need to do, please call your provider. We're there to help. That's what we want to do. Some people just need to talk.
Mm-hmm.
Some people need medication. And it's okay.
That's good. That's really good, because you know, you don't want anybody sitting around thinking that they're a bad mom.
No, and you're not a bad mom.
Because there have been many times that people have cried, and that's really just a normal thing, because you're just learning that new thing.
And you're sleep deprived, and you've got hormones that are doing all kinds of wacky things. But please talk to your provider.
Right.
And a lot of times we bring you in and we just give you a hug.
And
that's okay. That's all you might need. Uh-oh, I think we lost her again. So make sure that you're doing the things the CDC says. Wear your mask, wash your hands, be socially distanced, but don't isolate yourself. Make sure that you are reaching out to your provider. And if you have questions, call us. That's what we're there for. Okay, so that is the end of our talk today. We are out of time. This has been Family Health Matters with Wendy Bridgers some of the time. And we are on Awesome Radio. Thanks for joining us. We're here every Thursday. We are here from 3 to 3:30 on every Thursday, and we will have an interesting guest most every Thursday. We are on Facebook Live today, so if you can get to Facebook, you can like our page there and let us know what else might interest you and how we can help you. And Miss Bridgers will hopefully be back with us next week with her next guest. And I need to talk a little bit more. So, we are all done, and we will see you next week at the same